Welcome to Natural Healing with Peptide Therapy, what Big Pharma doesn't want you to know. Really excited to share all of this information with you tonight. And to get started, we are going to have Dr. Dusty Dubois come on and talk to us a little bit about optimal biohealth.
Hi, I am Dr. Dusty Dubois, and welcome to Optimal Biohealth. What is Optimal Biohealth? What is our mission? Well, it starts, as always, with my story. And my story is that a few years ago, I was trying to take my health from average to optimal. And what I found in the traditional medical approach was that they were measuring, like taking my blood, looking at my hormones, and measuring those levels from what a normal 50-some-year-old would look like. And I got to thinking, well, I don't want to be normal for a 50-year-old. I want to be back down when I was the most vibrant, when I had a good body weight, when I was strong and lean, when my skin was fabulous, when my sex life was rocking and rolling. And so I said, I need a different approach. So I found a doctor who was going to look at getting me from 50 to more like 30. And so my goal is to age in reverse. And so I met Anna. She is my partner in Optimal Biohealth and our advanced registered nurse practitioner. And we decided to go on a mission to help everybody be optimal instead of average. So one of those processes is implementing peptides to help reverse age us. And so I would like to introduce to you now Anna, who's going to explain to you what peptides are, how they work, and how they can take you from average to optimal. Welcome, Anna.
Thank you. Well, hi, everybody. My name is Anna Hyatt. I'm a nurse practitioner here at Optimal Biohealth, and I want to talk to you a little bit more today about peptides, what they are, how they can help you achieve the goal that you're looking for. And so let's talk first about what peptides are, because we're throwing this word around, peptides. What are peptides? What exactly do they do? So peptides are chains of amino acids that are found naturally in the body. And there's all kinds of peptides that do all kinds of jobs. But the ones that we are specifically interested in are the ones that are biomessengers. Now, peptides that are biomessengers are the peptides that work as messengers in the body. And so they send signals. They tell your body what it is you need, what it is you'd like for your body to do. And what we found is that we can replicate these peptides, add more of that particular peptide into the body. And by doing this, we can control how that peptide works and the results that we see as an outcome on your body. And how this is different from what you think of with a prescription is that a prescription is a chemical compound that is synthetic, that is not something that your body is already doing. It's not something that your body naturally creates. What's great about peptides is that they are. And so by recreating these peptides that are naturally in your body, naturally creating these signals, we have a much lower risk of having side effects or negative effects while we try and get that result that we're looking for. So let's talk about the 4 featured peptides that we're going to be carrying at Optimal Biohealth right now. There's many, many, many different peptides out there on the market, but we have 4 that we found are the ones that are going to help most people achieve the goals that they're looking for. The first one, of course, you already know about, which is semaglutide. And semaglutide is the weight loss peptide. It's the newest one on the market. A lot of our Optimal Biohealth members are already on semaglutide and have been having fantastic results. We also have something called body protecting compound 157 or BPC 157. We're going to be speaking about that one a little bit more. We have sermolin, which is a peptide that bodybuilders have used a lot in the past. And we're going to go into that. And we've actually got a testimonial of somebody who has been on sermolin and has been having really great results. And then my personal favorite is peptide 141. That one's really exciting. It's the last peptide we'll feature, and I know you're going to love it too. So let's talk a little bit more about semaglutide. I know a lot of you have heard a lot about it on the news. It's one that people are probably really familiar with right now. It is a glucagon-like peptide. that goes from your stomach to your brain and basically tells your brain, we're full, we're happy, we have everything we need. And as a result, you're consuming less, you're losing weight, and most people tolerate it very, very well. Because again, this is a natural peptide that's produced in the body that goes up to the brain. We're just adding in more of it. It's a weekly injection that you take that lasts for a whole 7 days. And so you've got this great appetite control that makes it so that you can go into a calorie deficit very easily and it's not stressful. And there's several benefits to starting semaglutide. The primary one is it slows digestion down. So even though you're eating less, you feel fuller longer. And as a result of this, your insulin sensitivity improves. It reduces inflammation, it's cardioprotective. And what's great is for a lot of people who are hearing that they're pre-diabetic, it lowers A1C levels and turns off cravings. So these sugar cravings that some people report, cravings sometimes for alcohol, people that have these particular types of cravings, it helps turn that craving down. Because again, the stomach is telling the body and telling the brain, I have everything I need, we do not need more. And so how do we get our results with semaglutide? What we want to do is find the minimum dose that will give you the maximum result. And so what we do is we start you out low and we titrate you up to what we call your therapeutic dose. So this, again, is the lowest dose where we're getting the result that we're hoping for without having these extra side effects or these extra negative effects that sometimes people experience, which might be a little bit of nausea, a little bit of reflux. So by doing this therapeutic titration, we get you at your optimal level. Now, some people will get on semaglutide and they'll have results right out of the gate. Most people do need to be on it for at least 3 months to start seeing really good, long-lasting results. And it's not just about the semaglutide alone. We also are going to be coaching you on nutrition. We're going to be teaching you how to meal plan. We're going to be doing monthly follow-ups. And because we're doing this, what we get is a good, consistent weight loss of about 15 to 20% for most people across the board, even people that have had a hard time losing weight. That's what makes semaglutide such a fantastic peptide to be bringing into your daily life. It gets results. Now let's talk about another really good peptide that we're also bringing on that is new, which is Body Protective Compound 157 or BPC 157. This is the healing peptide. Now what's unique about this particular peptide is it was developed to treat irritable bowel syndrome. But what they found as they were treating people with irritable bowel syndrome is that people were also having tendons get restored. They were finding that their muscles were getting built up. It was an anti-inflammatory that helped manage pain and heal wounds. And so what is cool about BPC 157 is it's not just, okay, we're going to put it in one area for this one thing that we're trying to heal. It will go throughout the whole body and it will seek and treat whatever it finds as in a soft tissue that it can treat. And so let's say, for example, you start taking it because you have chronic tendonitis in your elbow, but let's say you've also got a little bit of gastric inflammation that's been bothering you. In addition to treating the elbow, it's also going to treat that inflammation that's in your stomach. It is just a really cool peptide. A lot of bodybuilders have found that this is really useful for them because they want to build muscle, but they don't necessarily want to go on a steroid. And so BPC 157 is used exactly for this process. And as we age, a lot of times we need to support for the restoration process or angiogenesis, which is where we're needing to regenerate cells. BPC 157 has been found to be very useful in this. Another really cool feature about BPC 157 is that for people who are needle phobic, we also have a cream version. So you don't necessarily have to do daily injections with BPC 157 to get your results. If you want to, we can also try a cream. So that way we can get you your results without having you worry about being poked. The result with BPC 157 is most people will start noticing results within typically a few days. It's not going to get you completely healed. For optimal results, you are going to want to continue the program, particularly if this is a long-standing injury that we're trying to heal. But the nice thing is it's not something where you're going to have to go for a prolonged period of time before you start seeing results. A lot of people are going to start seeing results right away, which is fantastic. So if you have any questions about BPC 157, just remember we do have the question box where we can come back and get a little bit more in depth with your questions. Because I am going to move forward, we're going to be talking about our other two peptides, which are sermolin and peptide 141. Now, our goal with those is stopping the clock. A lot of us are coming into peptide therapy, again, like Dr. Dusty talked about, wanting to stop or even reverse the aging process. And with aging, there's all kinds of things that can happen to a body. A lot of people experience weight gain, they have trouble sleeping. Something that we don't really talk about very much in our culture is as we age, there's a definite loss of interest in sex or a loss of ability to have sex even. A lot of people just feel it doesn't have the same power as it used to have. And so peptide 141 is definitely going to help you out in that area. We also, like we talked about before, a lot of people as we age experience muscle loss and skin tone changes and elasticity changes. Those are definite signs of aging, as well as low energy, and for ladies, hot flashes. And we're always looking for new and innovative ways to help treat those, because maybe you're experiencing these things, but you're just not ready to go on a traditional hormone program yet. You want to know what else is out there. And so these are some of the answers we've come up with. So let's talk about our first peptide, which is sermolin, or the fountain of youth shot. Sermolin is an analog of the human growth hormone, which the body produces in abundance during our youth, but over time, there's a downturn. And so in our brain, there's something called a pituitary gland. And as we age, like in all things, the pituitary gland gets calcified and it slows down on its production of hormones. And so those hormone levels naturally decrease. There's less of effect. There's less intensity and all these things that we used to have, an abundance of energy, an abundance of just all these things that we could do naturally in our youth. And we just kind of slow down over time. And so what sermolin does is it stimulates that pituitary gland so that we naturally have an increase in all of these hormones that are circulating throughout our body. And because this is coming from our own natural pituitary gland, and these are our natural hormones, there's less side effects than people that maybe do direct hormone replacement. Not saying that there's anything wrong with direct hormone replacement, but again, this is an alternate therapy that we can look at for you and see if we can get you an optimal effect. Now, the benefits of sermolin over time is that you'll see improvements in your skin elasticity. You're going to see pretty much right out of the gate an increase in energy and vitality, and also improving your quality of your sleep. There's also the benefit of decreased fat in the abdomen and increase in lean muscle over time, which in turn gives you increased endurance, because again, you're sleeping better, you've got more muscle mass, your fat levels are going down, and so you're going to be a healthier, younger version of yourself. Okay, let's move on to PT141, which is one of my absolute favorite peptides that we brought out to you. Bremelanotide, or PT141, is a peptide that what it does is it excites the melanocytes in your skin. And it was originally created to help bring forth a tan with less exposure to sun. Well, what they found while they were making these beautiful tans is that for some reason that science still hasn't identified yet, it increased sexual enhancement for the people taking it. And so not only do you get a fantastic tan, but your sexual experience intensifies. Yes, this is a good thing. And so as a benefit of PT141, you're going to have mental and emotional intimacy getting accelerated. And because of this, because the intensity is so much more, naturally those pelvic floor muscles get strengthened because they're being worked out harder. This in turn helps promote bladder control for people that are noticing they're starting to experience a little bit of leakage with time. Like we talked about before, it enhances the tanning ability without prolonged UV ray exposure. Now, does that mean it'll just tan you on your own if you're in a dark room? No, you do need a little bit of sunlight to help trigger things. But what you'll find is that your ability to tan is much more enhanced. And then, like we talked about as well, there's increased sensation and potency with your sexual experience. And so your experience while you're having sexual intimacy is going to be much more potent, much more of a bang, and much more satisfying, which in turn gives you improved overall vitality, because how can you not feel wonderful when you're having a fantastic sex life and you look beautifully tanned? So how does it work with PT141? So depending on what it is you're trying to achieve, your dose is going to be a little bit different. So the dosing schedule that we use for sexual enhancement is going to be a little bit different than the folks that are trying to get a good tan. But nothing says that we can't combine the two together and get you good results with both. I think that is a great way to spend your summer. Okay, well, so that is our 4 peptides that we're bringing to you. Just to reiterate, most of our peptides are very well tolerated by the people who take them. They're synthetic versions of naturally occurring peptides that are in your body. So again, we're not bringing anything synthetic to you. This is just an enhancement of what's already naturally in your body. And so with that, unless there's any other questions, I'm going to turn the microphone back over to Dr. Dusty.
Anna, that was very informative. As you know, I am always the guinea pig on these peptides. And I do think we have another slide that we need to advance to. And I'm just going to share a little bit about my story. So the peptide that started it all for me is semaglutide. So that I have lost so far about 50 pounds. And it has been such an amazing experience. It's not just the weight loss for me, but it's all the other pleasant side effects that I have experienced, such as like the food noise, not constantly obsessing over food. That's gone. The inflammation is gone. I love getting adjusted, but I was so inflamed that process would be uncomfortable. Now that feels great. There's just, my skin is better. Everything's just better. So when I saw those results, I said, what else do you have for me? How can I level up? Because if I'm going to take this investment into my health, I want to go all out. So the next peptide that Anna recommended for me is Sermolin. So I've been taking Sermolin for a few months now. It is a 6-month commitment. So just like anything great in your life, if you want to experience those, the benefits, you have to commit to this. So I'm taking Sermolin because at the end of my weight loss, I did not want to just be skinny fat. I want to be muscular. I want to be strong. I want to have a really formed body. And so we decided Sermolin would be a really great adjunct to that. And that has been really an interesting process in that my body composition is changing so dramatically. I'm not just losing fat, but I am gaining muscle and I feel stronger than I ever have. And on a side note, this isn't just for like the menopausal women. My boyfriend is quite the bodybuilder. And when he learned we had Sermolin, he could not wait to get that going because it helps recovery time. It helps muscles grow bigger because remember, the growth hormone is only really present in your body when you're growing. And so once you're done growing, it really diminishes over time. So this is such a natural way to preserve that lean mass. And then the other peptide that Anna has put me on is the Vavavoom, the PT141 peptide. And so originally I got on that so that I could brown my skin before a trip I was taking. And it definitely worked, but the great side effect was everything that Anna explained. The desire to have sex increased, the pleasure of having sex increased. I know that sometimes we whisper when we talk about sexual intimacy, but come on, it's not anything to whisper about. I don't know anybody my age that doesn't want a little bit more and better experience. So we are bringing your sex life from average also to optimal. So grab the PT141 if you're planning on a trip and you want to create a nice little base and protect your skin. or if things have gotten a little bit stale in the bedroom, that will help you as well. And then the last peptide, as a chiropractor, I'm the most excited about. I've spent 25 years dealing with people with chronic conditions, and while chiropractic is amazing at dealing with these injuries, sometimes the chronicity and the damage is too far gone for us to 100% get that patient back to normal. And what I understand about this is that it seeks and destroys. So it finds the damaged tissue, the damaged collagen, and helps to repair that. So if you're a patient of mine and you have chronic problems, keep in mind, I'm going to be suggesting you meet with Anna to see if this is a solution to get you up over that bump in the road.